This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 rheumatology questions. Just a reminder that you can find these questions and many more on our website at medprep2go.com. If you have feedback or you'd like to get involved in this project, please email me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe to the podcast, give us a review, and let your friends know what we're doing, as that helps us a lot. All right, let's get started with the first question. A 45-year-old woman presents to the clinic with a 6-month history of joint pain and morning stiffness lasting over an hour. She reports swelling in her wrists and fingers, which improves somewhat with activity throughout the day. She endorses fatigue and denies fever, rashes, dry mouth, or dry eyes. Past medical history is significant for hypothyroidism, which is treated with levothyroxine. Family history is unremarkable. She drinks 2 glasses of wine per week and does not smoke cigarettes. Vital signs are within normal limits. Physical examination reveals synovial thickening in the metacarpal phalangeal joints and swelling in the wrist joints bilaterally. Laboratory tests reveal an elevated erythrocyte sedimentation rate, elevated C-reactive protein, positive rheumatoid factor, and elevated anti-cyclic citrullonated peptide, or anti-CCP, antibodies. Radiographs of the hands show early erosive changes. Which of the following is the most appropriate initial treatment for this patient? A. Hydroxychloroquine, B. Leflunomide, C. Methotrexate, D. Nonsteroidal anti-inflammatory drugs, or NSAIDs, or E. Sulfasalazine. The correct answer is C. Methotrexate. The clinical features of rheumatoid arthritis, or RA, can be diverse. Morning stiffness is a hallmark of the disease, particularly when it lasts for more than an hour. Joint pain and swelling predominantly affects the small joints of the hands and feet. Constitutional symptoms may include fatigue, myalgias, and unintentional weight loss. Common laboratory findings include elevated acute phase reactants, positive rheumatoid factor, and anti-cyclic citrullinated antibodies. Radiographs of the affected joints may reveal joint space narrowing and bony erosions as later manifestations of RA. Patients diagnosed with rheumatoid arthritis should be treated with disease-modifying anti-rheumatic drugs, or DMARDs, as soon as possible, because much of the joint damage that results in disability begins early in the course of the disease. Methotrexate is recommended as first-line therapy for DMARD-naive patients due to its efficacy in controlling disease activity and preventing joint damage. Answer choice A, hydroxychloroquine, is incorrect. While hydroxychloroquine is a DMARD used in rheumatoid arthritis, it is generally considered less effective than methotrexate for initial treatment in moderate to severe cases. Answer choice B, leflunomide, is incorrect. Leflunomide is another DMARD that can be used in rheumatoid arthritis, but methotrexate is typically preferred as the first-line agent. Answer choice D, nonsteroidal anti-inflammatory drugs, or NSAIDs, is incorrect. NSAIDs can help with symptom relief but do not prevent joint damage and are not considered DMARDs. Answer choice E, sulfasalazine, is incorrect. Sulfasalazine is a DMARD that can be used in rheumatoid arthritis, but methotrexate is the preferred first-line treatment. The key learning point here: patients diagnosed with rheumatoid arthritis should be treated with disease-modifying anti-rheumatic drugs, DMARDs, as soon as possible, because much of the joint damage that results in disability begins early in the course of the disease. Methotrexate is recommended as first-line therapy for DMARD-naive patients. Question 2. A 52-year-old man presents to the emergency department with sudden onset of severe pain, redness, and swelling in his right great toe. He reports that the pain started last night and has progressively worsened. He denies fevers or any trauma to the affected toe. He has a history of hypertension and obesity and takes lisinopril with hydrochlorothiazide. He drinks 4 beers per week and does not smoke cigarettes. Vital signs are within normal limits. On physical examination, the right first metatarsal phalangeal joint is erythematous, warm, and extremely tender to touch. Laboratory tests reveal a normal complete blood count and elevated serum uric acid level. Arthrocentesis of the affected joint is performed. Which of the following findings is most likely to be observed in the synovial fluid? A. Calcium pyrophosphate dihydrate crystals with positive birefringence. B. Gram-positive cocci. C. Needle-shaped monosodium urate crystals with negative birefringence. D. Oval fat bodies. Or E. Red blood cells. The correct answer is C. Needle-shaped monosodium urate crystals with negative birefringence. Gout is a form of inflammatory arthritis characterized by sudden, severe attacks of pain, redness, and swelling in joints, often affecting the great toe. Gout typically presents as monoarticular arthritis, meaning it usually affects one joint at a time. The first metatarsal phalangeal joint, the big toe, is most commonly affected site, a condition known as podagra. Risk factors for gout include obesity, hypertension, a diet high in purines, such as red meat, seafood, and beer, alcohol consumption, and certain medications like thiazide diuretics. This patient takes hydrochlorothiazide, which increases the amount of urate that is reabsorbed in the proximal renal tubules, increasing serum uric acid levels. Gout is caused by the deposition of monosodium urate crystals in the joints due to elevated levels of uric acid in the blood, known as hyperuricemia. These crystals are needle-shaped and exhibit negative birefringence under polarized light microscopy, which is a key diagnostic feature. Management of acute gout attacks involves NSAIDs, colchicine, or corticosteroids to reduce inflammation and pain. Long-term management focuses on lowering serum uric acid levels with medications such as allopurinol or febuxostat to prevent future attacks. Answer choice A, calcium pyrophosphate dihydrate crystals with positive birefringence, is incorrect. These crystals are associated with pseudogout, which presents differently from gout. Pseudogout usually affects larger joints like the knee or wrist. Gout attacks start suddenly and usually peak around 8 to 12 hours, while pseudogout attacks can start suddenly or be more indolent over several days. Answer choice B, gram-positive cocci, is incorrect. The presence of bacteria would suggest septic arthritis, not gout. This patient does not have fever or leukocytosis to suggest septic arthritis. Answer choice D, oval fat bodies, is incorrect. Oval fat bodies are typically seen in the urine in nephrotic syndrome, not in synovial fluid analysis. Answer choice E, red blood cells, is incorrect. While red blood cells may be present in traumatic arthrocentesis or after hemarthrosis, such as in an anterior cruciate ligament tear in the knee, they are not characteristic of gout. The key learning point here: gout is characterized by monoarticular arthritis, elevated serum uric acid levels, and needle-shaped monosodium urate crystals with negative birefringence in the synovial fluid. Question 3. A 28-year-old man presents to the clinic with a 6-month history of lower back pain and morning stiffness that improves with exercise, but not with rest. He also reports occasional eye pain and eye redness. Past medical history is unremarkable, and he does not take any medications. He does not know the details of his family history, but states his father had similar symptoms. Vital signs are within normal limits. On physical examination, there is reduced spinal mobility and tenderness over the sacroiliac joints. Cardiac, pulmonary, and abdominal examinations are unremarkable. Laboratory tests reveal elevated erythrocyte sedimentation rate, ESR, and elevated C-reactive protein. A pelvic X-ray shows evidence of bilateral sacroiliitis and a bamboo spine appearance. Which of the following is most likely associated with this condition? A. Anti-cyclic citrullonated peptide, anti-CCP antibodies. B. Anti-double-stranded DNA antibodies. C. Anti-nuclear antibodies, or ANA. D. Human leukocyte antigen B27, or HLA-B27. Or E. Rheumatoid factor. The correct answer is D. Human leukocyte antigen B27, or HLA-B27. Ankylosing spondylitis is a chronic inflammatory disease that primarily affects the axial skeleton, leading to back pain and stiffness, particularly in young men aged 20 to 40 years. The sacroiliac joints are often the first to be affected, and as the disease progresses, the vertebrae can fuse together, resulting in a bamboo spine appearance on radiographs. This fusion leads to loss of spinal mobility and can cause kyphosis. Ankylosing spondylitis is strongly associated with the presence of HLA-B27, a genetic marker found in a significant proportion of patients with the condition. Other associated symptoms can include uveitis, fatigue, fever, rash, weight loss, and abdominal pain. Elevated inflammatory markers such as ESR and CRP are commonly seen. Answer choice A, anti-cyclic citrullonated peptide, anti-CCP antibodies, is incorrect. Anti-CCP antibodies are specific for rheumatoid arthritis. Answer choice B, anti-double-stranded DNA antibodies, is incorrect. Anti-double-stranded DNA antibodies, as well as anti-Smith antibodies, are highly specific for systemic lupus erythematosus. Answer choice C, anti-nuclear antibodies, is incorrect. ANA is associated with systemic lupus erythematosus and other autoimmune diseases, not ankylosing spondylitis. Answer choice E, rheumatoid factor, is incorrect. Rheumatoid factor is associated with rheumatoid arthritis, not ankylosing spondylitis. The key learning point here: ankylosing spondylitis typically presents with back pain and morning stiffness in young men, with sacroiliac joint involvement and a bamboo spine on radiographs. It is associated with HLA-B27 and can present with systemic symptoms such as uveitis and elevated inflammatory markers. Okay, that's it for this episode, but please do check out our other episodes, and a reminder that you can find all of this content and much more at medprep2go.com.